So when you think about what builds better partnerships between public and private sectors, we're really at a point now where when we were dealing with bugs and bacteria, it was really easy to just kind of go into a clinician's office, get some medicine, and you know, patch you up and get you on your way. That's not how it works anymore. Right now, it's the environment where we live that are the drivers of what is making us unhealthy. And I think what you have to do is find that shared understanding. Right. So as a public health person, I care about the health of the community. And so making this pitch to me is really easy. But a large business, profits may be what is driving them, and then helping them understand that the workforce that they have, everyone who lives in that community is either their employee or their consumer. And so having good health is really foundational, right? And anything that you do, it's just like owning a home. You can have the nicest wallpaper and the best curtains. If the foundation of the home is rotten, it will eventually fail. And so we need to work better to understand that nothing is really achievable in our communities without good health. You can't go to work and be present if you're worried about your housing security. You can't go to a worship service on a Sunday if you're hungry. So this is foundational, and we need to invest resources to ensure that our foundation is solid before we start working on other aspects of our community house. So I think what we've seen with the health of cities through our city health program is that there's a real appetite to improve city health. We didn't know when we launched the program if anyone would even care that we were giving them a medal around health policy. Because health policy can be somewhat amorphous. It's not necessarily what people default to. But I think what we found is that city leaders care about health. They understand the connection to the economy. And what they really just want to know is, what should they do? And so City Health gives you this kind of package of 9 policies. And if we can get all 40 cities to adopt these 9 policies, I think we'll see a change in health for the people in those cities, and will help really develop the city into a much more vibrant and economically strong place to live. So all too often when public health goes to talk to businesses, there's a belief that we're there to ask for money. And you help us fund this program or help us do this intervention. But that's really not what we need from businesses right now. I worked a decade in governmental public health. And when I went to the city council, they kind of saw me as yet another whiny governmental worker saying they needed more money. But if our 3 largest employers went to city council and said, we're concerned about the health of our community, and we need you to fund public health because everyone who lives in this community is either our employer or our customer, they will listen. We need to make sure that every public health leader knows the 3 leading causes of mortality, which they all know, but they also need to know their 3 largest employers and engage them more actively. So it's really about a governmental relations play and saying, if we have an outbreak, if we have a disaster, if we have something that is going to disrupt our operations as a business, that the governmental public health infrastructure is there to help us. And so we should support them in city council meetings, in county commissioner meetings, in mayoral elections, and let people know that public health is vital to good health, because good health is ultimately good business. Well, when you think about what we can do to help ourselves, of course we can exercise and we can eat healthy, but I would tell you the greatest public health intervention that has ever been invented is voting. And we need to think about, do we have candidates who prioritize not just health care, but health? It can't be helping us only when we're sick. It's about looking at housing, looking at education, looking at transportation. And we need comprehensive treatment plans for our community, just like you would want a comprehensive treatment plan if you were sick. And that's the only way we're going to get to health. And so the best thing I can recommend for an individual is become an informed voter and really ask questions about health rather than just about insurance.